Hey everyone, and welcome to MediByte. We often think about the connections between our health and the world around us. Well, today, we're diving into a really interesting one, a parasitic infection that links us, our pets, and even the environment. It's called echinococcosis, but you might know it better as the dog tapeworm infection. So, could man's best friend really carry a hidden danger? Now, I know that question sounds a little scary, right? But stick with me, because it's definitely worth exploring. We're going to break down exactly what this infection is, how it actually gets around, and this is the most important part, the super simple things you can do to keep yourself and your loved ones safe. Ready? Let's jump in. Okay, so what is echinococcosis? Well, at its heart, it's an infection caused by the larvae of a specific type of tapeworm. There are a couple of main versions we look out for. One is Echinococcus granulosus, which creates these distinct, almost balloon-like cysts. The other, Echinococcus multilocularius, is much rarer, thankfully, but it's a bit more aggressive. It can grow in a way that's kind of like a tumor. Now, the full-grown adult worms, they live in the intestines of dogs and other animals in that family, like foxes or wolves. But here's the key thing for us. If a human gets infected with the eggs, they don't grow into worms inside of us. Nope. Instead, they form these things called cysts. And a great way to picture this is to think of these cysts as, as slow-growing, unwanted tenants inside your body. Seriously, they're these little fluid-filled sacs that just gradually expand, kind of like tiny balloons inflating over months or even years. And because they grow so slowly, a person might not have a single symptom for a really, really long time. That's why we often call it a hidden infection. It's just quietly taking up space before you even know it's there. So how does this parasite even make its journey? The whole life cycle is actually pretty fascinating, in a creepy-crawly sort of way. It all kicks off when an infected dog passes microscopic eggs in its stool. These eggs then end up contaminating the soil, water, you name it. Then what we call an intermediate host, think of an animal like a sheep or a goat, comes along and accidentally eats these eggs. Inside that animal, the eggs develop into cysts in their organs. The cycle keeps going when a dog eats those infected organs. So where do we fit in? Well, humans are basically accidental tourists in this whole process. We become an unintended host if we happen to ingest those microscopic eggs. And here's what makes this a real challenge. Those eggs are unbelievably tough. I mean, they can stay alive and infectious in the soil for up to an entire year. So you can see how an infection could happen, right? It could be from eating contaminated food, drinking contaminated water, or even just petting an infected dog that has eggs on its fur and then, touching your mouth. It really, really drives home how crucial simple things like hand washing can be. Okay, so let's say someone does get infected. What happens then? Well, here's the deal. The symptoms you feel depend completely on where those cysts decided to set up shop in your body. It's all about location, location, location. If they're growing in the liver, you might start feeling things like abdominal pain or see a yellowing of your skin and eyes. That's jaundice. But if the cysts are in your lungs, you're looking at different signs, like chest pain, or maybe even coughing up blood or some of the cyst fluid. Now, one of the biggest dangers with this infection is if a cyst bursts. This is a big deal. The fluid inside is highly allergenic, and if it leaks out, it can trigger a massive reaction from your body. We're talking hives or even worse, anaphylaxis. And that's that severe, life-threatening allergic reaction where you can go into shock and have trouble breathing. It's exactly why getting a proper diagnosis and careful treatment is so incredibly important. The good news is, doctors have some fantastic tools to find these hidden tenants. They're not just guessing. Imaging scans, things like ultrasounds, CT scans, and MRIs give them a really clear picture of the cysts, showing exactly where they are and how big they've gotten. If they suspect something in the lungs, a simple chest x-ray often does the trick. Plus, blood tests can be a huge help too. They can spot the antibodies your body creates to fight off the parasite, which is a big clue that it's there. Okay, so a diagnosis is confirmed. What's next? The treatment plan is really a two-pronged attack. The goal is, number one, to safely deal with the cysts that are already there, and number two, to completely wipe out the parasites so no new ones can form. And while major surgery is definitely one option, it's not always the go-to anymore. There's a really common, much less invasive procedure. Basically, using an ultrasound to see what they're doing, doctors guide a very thin needle into the cyst to carefully drain out the fluid. After that, they inject a special salt solution to kill off any bits of the parasite left inside. And to top it all off, this is usually followed by a course of an oral medication called albendazole. Think of it as an insurance policy to make sure no stragglers are left behind to cause more trouble down the road. So, we've talked about treatments, and they are effective, but you know what's even better than treatment? Prevention. And the best news of all is that protecting yourself from this isn't some complicated, crazy thing. It really just boils down to a few simple key habits. Think of these next steps as your personal toolkit for staying safe. Rule number 1, and it's a big one: wash your hands really well with soap and water, especially after you've been petting or playing with dogs. Also, be smart about your food and water, especially if you're in an area where this parasite is more common. On a bigger scale, educating farmers about not feeding raw animal organs to their dogs is a huge step in breaking that life cycle we talked about. And finally, for all the dog owners out there, making sure our furry friends are on a regular deworming schedule is absolutely critical. It protects them and it protects us. So, let's just wrap this up. Here at MediByte, we really believe that knowledge is the first step to good health. Echinococosis, yes, it's a serious parasitic infection. But, and this is a big but, we understand its life cycle, and it is absolutely preventable. Simple hygiene and being a responsible pet owner, honestly, those are the most powerful tools in our arsenal to protect ourselves and everyone around us. And that kind of leaves us with a bigger question to chew on, doesn't it? How does understanding these hidden journeys, these invisible connections between parasites, animals, and the environment, how does that change the way you see your own relationship with your pets and with the world around you? If you found this breakdown helpful, do us a favor and hit that like button and maybe share it with someone you think would find it interesting. And of course, for more clear, reliable health explainers just like this one, make sure you subscribe to the MediByte channel. Thanks so much for hanging out with us today.